public hospital, polyclinics, GP clinics have been and are still very busy, and healthcare workers have been coming under significant stress. Fortunately, the ICU utilization rate are well within capacity, and so too are infected patients who need oxygen supplementation. However, normal wards, especially the emergency departments, they are overloaded. In tandem with the drop in cases over the past couple of weeks, the number of emergency department attendants has come down somewhat over the same time period. It used to be 3,000 cases a day attended to by our public hospitals, and that has dropped to 2,800 cases a day. Some drop, but it is still a very high number. To support the hospitals, MOH has stepped up various efforts. One is to beef up manpower for public health institutions. And this, we have tremendous help from the SAF, and we thank them very much. They have supplied us with very skilled medics, as well as their supervisors. We have also recalled nursing students who are doing their advanced diplomas, about 300 of them, and thank them for returning back to work and staying the post and contributing to the public hospitals. We are transferring more patients from public hospitals to other care settings. One major care setting are the private hospitals. We got the private hospitals to raise the risk profile of the kind of patients they can take in, and as a result, they have been increasing the number of patients they can take in from the public hospital. So we can now transfer more patients from public hospitals to private hospitals, which is a big help. We also we have been increasing the number of transfers from public hospitals to our CTFs, the COVID-19 treatment facilities. Let me explain this a bit. We used to have many CTF beds, more than 4,000 of them, but they were not well utilized, only 10 to 20% occupied. So we work with the CTFs, who are operated by private healthcare providers, to repurpose the facilities, consolidated their manpower so that we improve the nurse-to-patient ratio, and so that they are also able to handle higher risk patients now. And this allowed more patients in public hospitals to be transferred to the CTFs. So now the CTFs are 50 to 60% occupied now. Where possible, hospitals will also provide home care instead of hospital care and give the family support so that the patient can recover at home. We also partnered various stakeholders to reduce emergency department admissions, such as SCDF may now bring clinically stable patients directly to CTF rather than to public hospital and then decant to CTFs. We are also, from this week onwards, from the start of this week, we have been diverting some non-COVID cases from private hospitals and care facilities, or rather, let me repeat that. We are starting to divert some non-COVID cases from public hospitals to facilities outside of the public hospitals, such as private hospitals and the CTFs. So these are non-COVID but stable patients who require monitoring and management of their chronic conditions. And we set up specific facilities, such as an entire hall at Connect and Changi, where these patients can be re-sited. And that will free up capacity and reduce the load in public hospitals as well. So because of all these efforts, we have managed to transfer, on average, 470 patients per day out of public hospital wards and their EDs every day. COVID-19 cases in hospitals have fallen from the peak of about 1,700 to 1,450 now, but as I say, it's still a high number. And we'll continue these efforts to relieve the public hospitals, especially their emergency departments.